As Omicron is slowly seeping into almost every state in India, the centre has now approved new vaccines and drugs for emergency use in India. These are Corbebax and Covovax. These COVID-19 vaccines and an antiviral drug as well, Molnupiravir, have been given a nod. What makes them different from the existing vaccines and how do they fight COVID-19? Well, let's find out. So far, 6 COVID-19 vaccines have received emergency use approvals from the Indian drug regulator. These are Serum Institute's Covishield, of course, Bharat Biotech's Covaxin, Zydus Cadela's Decoded, Russia's Sputnik V, and US-made Moderna, as well as Johnson & Johnson. But this time, the Indian drug regulator has also given a nod to a drug to fight COVID-19, a pill. Molnupiravir, as it's called, it is an antiviral drug that will be manufactured in India by 13 companies. This Merck's pill basically treats adult COVID-19 patients diagnosed with oxygen saturation levels as low as 93%. The drug is not authorized for use in patients less than 18 years of age or for longer than 5 consecutive days, and for also pre-exposure or post-exposure prophylaxis for prevention of COVID-19 in pregnant women. How does this antiviral pill work? Well, Molnupiravir is an orally administered form of ribonucleoside that prevents the replication of SARS-CoV-2, which causes COVID-19 in the body. It forces SARS-CoV-2 to try to replicate its genetic material. However, as the process begins, the pill inserts errors into the genetic code. People who will take this pill will have to go through a course that includes taking 4 capsules twice a day for at least 5 days. And then we have Corbebax, which has now been given a nod. The COVID-19 vaccine, developed by Hyderabad-based firm Biological E, is now India's first indigenously developed RBD protein subunit vaccine against COVID-19. How it works? An RBD protein subunit vaccine induces protective immunity by targeting the RBD of the S protein of SARS-CoV-2, which is a harmless protein. In fact, the RBD is a part of the spike protein of SARS-CoV-2. The virus uses the spike protein to attach itself to host cells. Corbebax injects the spike protein that helps in generating an immune response in advance. Now, since the spike protein is without the virus, the body uses the antibody generated to fight the real virus when it attempts to infect the system. Covovax. Now, this vaccine is a nanoparticle vaccine developed by Novavax and manufactured under license by the Serum Institute of India. On December 17th, the WHO had issued an emergency use listing for Covovax. The DCGI office has now granted Serum Institute of India permission to manufacture and stock Covovax on May 17th. So far, the Pune-based firm has manufactured and stockpiled the vaccine doses. How it works? In this case, the receptor binding domain, or RBD as it's called, is attached to a protein designed to form nanometer-sized protein particles, or nanoparticles as they call it. Nanoparticles help improve vaccine efficacy by targeting desired antigen-presenting cells to improve immunization strategies.